He's the former president and publisher of the Sun Herald, and now he's on the radio. Welcome to Coast View with Ricky Mathews on SuperTalk Mississippi Gulf Coast 103.1.
Welcome to Coast View, the show that celebrates the men and women who are making coastal Mississippi such a great place to live, work, and play. Again, I want to say Happy New Year, and I hope your New Year started off with a positive vibe. Thank you for joining me here at Coast View. We're celebrating the 1-year anniversary of Coast View this week. It's amazing, actually, that a year has already passed. We've had nearly 500 conversations celebrating the best of coastal Mississippi, and we've also tackled a few challenges along the way, not to mention a hurricane and COVID-19, which, those two incidents, especially COVID-19, created so many significant challenges for us. I even shared my own COVID experience along the way. But I can't tell you how much I appreciate you joining us here on SuperTalk 103.1. And if you're listening on Facebook or YouTube or any of the popular podcast platforms, we appreciate you joining us there as well and celebrating with us the best of coastal Mississippi. I'm honored to sit here in this chair in the coastal Mississippi studio. And as you contemplate the Coast View challenge that I've issued about taking the best version of ourselves into your post-pandemic world, I want to share something I read this morning from Rich Roll. Rich Roll is a fitness expert, and he has what he calls the 2021 touchstones. And I just think these are terrific. He says this: lead with curiosity, welcome uncertainty, embrace nuance, empower others, lean toward fear, train weakness, trust others more, separate from expectation, choose depth over breadth, let go of old stories, permit more joy, love without condition, and steer with gratitude. Wow, those are really powerful words, and I'll continue to share these things, hopefully kind of motivating you to get off on the new year on the right foot. So let me bring Kyle into the story and say good morning. How you doing, buddy?
Good morning. Doing pretty good. How about yourself?
I'm doing fantastic, man. It has been fun and educational, especially educational, talking to so many dedicated leaders over the past year, hasn't it?
It really has. It's pretty much broadened my horizons, that's for sure.
Like I said yesterday, you're a philosopher. Kyle the philosopher.
More of a backwoods philosopher.
Well, man, look, here's the thing. You've learned with me. We've been on this journey together. I rarely will say I mean, it's been me and you together on this journey, and others who have sat in for you along the way. But gosh, we're really fortunate to be in coastal Mississippi with so many incredible people who are dedicated, who are volunteering their time, who are building strong companies. It's just been inspiring, hasn't it?
It has. It's been really nice to sit back and watch the growth as we've progressed through the pandemic of all the uncertainties, and now we kind of know which direction we're going in and how to stay safe and all the things we have to do. And yeah, there's still a few people that whatever, but each their own.
Well, that's true. And listen, I couldn't think of a better producer to have than you. So thank you, buddy. I really appreciate it. I
finally know what most of these buttons do now.
I know you do. You're the mad scientist for sure. With that in mind, this whole notion of great leadership, I'm so thrilled to have Lee Bond with us today, the Chief Executive Officer for Singing River Health System. He's been on the show so many times. And so Lee, come on in and join me. And hey, it's a good morning. Good morning to you.
Good morning.
So it's about 6 months, give or take a month or two, till the vaccine fully kicks in, and we've issued a Coast View challenge that I mentioned a minute ago to bring the best version of ourselves into the post-pandemic world. And it could be something like just choosing to be kind. And when I think about that, I think it's something that Ralph Waldo Emerson said. He said, "You cannot do kindness too soon because you never know how soon it will be too late." Tim
McGraw, always be humble and kind.
Always be humble and kind. Oh my gosh, for sure. People could be choosing to improve their mental and physical health, or they could be volunteering their time to a worthy cause in the community. I mean, the honor, the gift of their energy and their time. But do you use this opportunity in the new year to recalibrate yourself?
Sure, a little bit. I'm not a big New Year's resolution kind of guy. I'm if you're going to start something, start anytime. But it is a good, because the world's mindset is sort of new year, new me type thing. A lot of people are thinking. So we do use it a little bit as an opportunity. We've rolled out, the marketing team has rolled out a little program called Do What It Takes, and it's dowhatitakes.org. And on there, we basically are talking about things you can do to help put yourself in a better position to deal with COVID in the new year. And while vaccines are a part of that, it actually starts with some of the things that we've talked about all along. The simple things: isolate if you're ill, wash your hands, don't be a close talker. But to your point earlier, it's got some other things on there, like take care of your health. That is one of the biggest things you can do to make yourself stronger against COVID, is to take care of your health, not just through a vaccination from COVID or from the flu, but other things like eating better, stop smoking. And we're really going to heavily focus on that this year. We've got a program, we call it the Healthy Revolution, the Senior River Healthy Revolution Blueprint, where sort of our own diet plan, I guess, if you will, or our program we're rolling out. We're excited about that. But taking care of your health is something that is critical, or more critical than it's ever been in our history. And then one other thing that we've also focused on, Ricky, is take care of others. We would like to issue a call along the parallel of yours to be your best self sometimes means being selfless. And that's what I think is missing in the world today. Everyone, the majority of people are selfish, not selfless. And I think we see that in the political world, in the medical world, and everywhere. And if people would focus in 2021 on being selfless, the world would be a better place, for sure.
One of the things I talked about yesterday, something I'm going to be focused on is, I don't know if you've been really paying attention to the book tour that Matthew McConaughey is doing, but in his new book, he talks about actually the name of the book is Green Lights, and it's a lot of inspiring aspects to it. But he's also the minister of culture in Austin. And one of the things he's working to do is capture the essence of Austin. Austin is going through a lot of growth today. And he's concerned, as other people are concerned, that it's going to lose the soul, what made Austin so special. So what they're doing is they're enumerating all the values and the culture of Austin, so they can put them in sayings and help people who come to the community learn how to think. Well, one of the things he says, in line with what you just said, is that politics divides us, and that too often we're in a position where we're being divided. But the thing that brings us together in this community are the values and the culture of the community. It really transcends politics. And, we see these opportunities. I mean, some of it has arisen as a result of COVID. Some of it's arisen as a result of the hurricane. When the power was out, I often talked about neighbors talking to neighbors across the yards, and people helping each other. I think when the going gets tough, we see some of the best of coastal Mississippi. I think if we could just remind ourselves on a constant basis that is the secret sauce of this community. And too often we sort of get busy in our lives and we forget to help our neighbor. But the good news is, at our core, we have that already. We just have to be reminded of it. And we have to remind our neighbors that we care about them. And man, that could go a long way. That could really...
One thing is to try to put other people ahead of yourself a little bit this year. That absolutely needs to be a focus, locally and really nationwide. But I think we are better at that than a lot of areas. After what we went through with Katrina, we've found the value of helping each other. And I think in this pandemic, there's been a lot of that as well.
I worked hard on my show over since the pandemic started to try to not let things like the tools that you have so often talked about, the face mask, the social distancing, the washing the hands. I mean, I quoted you a bunch of times. If you haven't washed your hands in the past hour, you waited too long to wash your hands. Okay. Don't touch your face. Don't do close talking with people. These are basic tools. They've been with us from the very beginning. They work. You're in a healthcare profession. You see it every day. You've used them yourself. You've not gotten COVID, and you've been around COVID from the beginning, haven't you?
I have, Ricky. I've been in ICU rooms. I've been in med surg rooms. I've walked and pushed a patient down the hallway that was COVID positive with a nurse, and I've not gotten it. And I don't think that has anything to do with blood type. It doesn't have anything to do with all these other theories. I think it strictly has to do with I am insanely religious about hand awareness, about physical spatial distance with people, and just about being religious about washing my hands and being careful, because that is far and away in our contact tracing. That's why the home is the most dangerous place. Of course, I often say if everybody would just go to work, we'd have a lot less COVID. But honestly, it's avoidable, and you just have to be careful.
Well, the thing that I've worked to do, Lee, this is Lee Bond from Singing River Health Systems. The thing I've worked to do, when this thing was getting politicized, I was just saying, man, don't get sucked into that vortex. Don't let something like tools that can protect ourselves and our family members and our loved ones. Don't let something like that get politicized and cause you, as you pointed out, to be selfish, because that's what ends up happening. I can say it, and I've seen it. You've seen it. We just had, and look, the pandemic's not over. We've got work to do. We've got to stay focused on protecting people. Hey, when we come back, we're going to talk about the latest at Singing River Health Systems as it relates to COVID. We'll talk about some other things that are happening in 2021 as well. But anyway, we'll be back with Lee Bond here in just a second.
Coast View on SuperTalk 103.1 is brought to you by Allen Toyota on I-10 exit 38 Gulfport. See all of the incredible inventory at allentoyota.com. And remember, when you think Toyota, think Allen Toyota.
Talking to the people that help make the coast such a unique place to live. This is Coast View with Ricky Mathews on SuperTalk Mississippi Gulf Coast 103.1.
Welcome back to Coast View. We have Lee Bond, who's the CEO of Singing River Health Systems, with us today. And we're going to talk about the numbers coming up shortly. But one of the things that I wanted to make sure we really focused on, after you and I talked about how we can never forget the commitment and the sacrifice that healthcare professionals have made, Dr. Nicholas Conger came on the show. He's the infectious disease internist at Memorial. He's been a great friend to the show, and it's such practical advice that he's given on an ongoing basis. But he talked about, we tend to think about doctors and nurses, and we don't remember that, or we don't appreciate that we're talking about radiologists and pulmonologists, and anyone who comes in contact with that patient. Could be a custodian, could be clerks, could be any wide number of people. But the sacrifice that they're making. One of the things he reminded me of, and would like to get your thoughts about this, is that especially in the beginning of COVID, we had a number of patients who died without family members present because, family members couldn't be with them. And oftentimes it was the healthcare professionals that would be in the room with them holding their hand while they died. We don't remember. It's easy to forget. And that's a painful thing to contemplate, but it talks about the sacrifice, the psychological and emotional sacrifice that healthcare professionals have had to make. What do you have to say about all that?
I would say that's true. And I think that the environmental services workers, the housekeepers, they're the secret silent heroes in this whole thing. They have worked right alongside nurses. They're the ones that are cleaning the rooms that have COVID in them. Obviously, the nurses, I think I put them at the top of the pinnacle, and we can't honor them possibly enough. But you're right. There's also the nurse techs. There's people like the lab. Our lab director, she worked like 45 days straight right through Easter, developing the ability for us. We've tested like 55,000 people, and that's really a function of her hard work in the beginning, and then her team stepping up to work right there with her. Lately, a hero has been the pharmacy. This with the bamlanivimab, the Regeneron, and the vaccines. They have been working around the clock. The people in the clinics and frontline folks, medical assistants, people in reception, people answering the phones, and even managers, that of those clinics doing things they might not normally do. It's been, I'll be honest with you, it's been inspiring and uplifting to watch their grit and their resolve. They've been absolute heroes, warriors through this whole thing, and continue to be. They're just tough, and I'm so appreciative of every one of them. That's the thing that makes me want to work even harder when I watch them.
Well, the reality is, just because 2020 is now behind us and now we're in 2021, we didn't leave the pandemic behind. It's going to take several months for us to get to a place where we can find whatever that new normal is going to be. But so if you continue to watch the numbers nationwide and in Mississippi, the numbers have not been good. So what do you have to say about the COVID situation?
So yeah, actually, I think sometimes we see the new year as a cutoff. Everything's behind us, and that's actually not the case at all. We had 85 total positives throughout our three systems, three hospitals, Pascagoula, Ocean Springs, and Gulfport. We had 85 total positives. That's the most we've had, a new record. Today we're at 74, so a little better. Some of that is a function of receiving patients from central Mississippi that's oversaturated, but it's a very tenuous situation when you've got your emergency room has people being transferred from central Mississippi and your rooms end up at times full. We're fortunate to have the three hospitals to be able to, move people when needed, when there's the space available. But it's been concerning. I think that we're going to have, due to people being in their houses more with the colder weather, coupled with the New Year's get-togethers, and a little bit of people letting their guard down because, hey, it's a new year and the vaccines are out there. We've seen a little bit of, people kind of reducing their guard, and I think there's going to be some impact to that. But like I said earlier, we're tough, and we're going to face it head on. We're not going to whine about it. But some people are going to do what you ask, and some aren't, and that's just the way it is. And we're prepared to deal with it. But hopefully, we'll have another peak here soon, and then with the vaccines, we'll start seeing a downhill slide over the next few months. That's our hope.
So Lee, what I hope we can do by talking about the healthcare professionals as aggressively as we talk about these amazing heroes is to remind people who may be dropping their guard or who may not be paying attention that do it for the healthcare professionals. Help us minimize the impact on our health and our healthcare institutions, because Mississippi, we're not doing elective surgeries that require hospitalization in Mississippi right now, and that hurts you guys financially. And how do we?
It hurts doctors. It hurts doctors personally more than anyone, and that's tough because we need doctors. It
hurts patients. It hurts patients. Good Lord.
It does.
So anyway, I'm glad to hear that the numbers are down today, but let's hope that we can get a new trend going and that people will help us sort of manage this thing.
I like where you pointed out, do it for other people. And again, doititakes.org, our little microsite, focuses on that. It's about selflessness. Our healthcare professionals, Ricky, they are watching people's mothers and aunts and uncles, these older folks with comorbidities. They see them deteriorate. It is heartbreaking to watch someone go through this. And yeah, if you're 35 years old or 45 years old and you have no issues, then great for you. But if you get it and you interact with an older person and they get it, you're the cause of that, ultimately, of that person down the line having their demise. So it's all about selflessness. Put other people first. That's one of our main messages for 2021. Yet again, let it be the year that we were able to say that we were selfless in America.
So Lee, let me ask you this. We're hearing reports across the U.S. that the vaccine rollout has been sluggish. What's your experience at Singing River Health Systems?
So we were the first on the coast to receive a shipment of vaccines, and we got 1,156 of them. There were more in there than were expected, which was great. It was like a great Christmas gift, but we rolled those out. We had all hands on deck, and within about 48 to 72 hours, we had them administered. I have told the health department we stand ready to help. We have got the people, the resources, the electronic platform for tracking. We've got the best, the MyChart application, the best electronic health record in the world. Let the healthcare providers administer this. The health department is doing it, and I don't know how it will go, hopefully well, but we stand ready to serve. If they will get supply in our hands, we'll work day in, day out. We'll work holidays, weekends, at night, whatever it takes. And I don't know that government is really set up for that type of distribution. I think that there's too much reliance on the government and not enough reliance on hospitals that are businesses to get this out. And so we're going to do everything we can with whatever supply we get. We will we will work around the clock to administer it. But I think that's why it's been sluggish, is because it's largely government controlled. They're doing the best they can. But I think that more distribution to hospitals would help get it out faster, for sure.
Well, I mean, Lee, you guys do this every day. This is what you do. This is what you do. So hopefully, again, we've never done this before. So you learn from your experiences. And so the sluggishness of the startup might precipitate some changes that will help us get the vaccine out sooner.
Well, I was glad to see that they are going to try to distribute it through health departments to people that are 75 and older. Let's face it, the goal should be to focus on the people that are the most at risk. And while first responders are certainly at risk, you don't hear about a lot of first responders dying from this. You hear a lot of people that are 75 with chronic kidney disease dying from it. So the sooner we can take care of the people who are most likely to die if they get it, the happier we will be.
So let's switch gears. One of the things that Dr. Conger pointed out is that the death rate is down because the treatment has gotten so much better. We really understand much better how to treat this. Aggressively keeping people off ventilators, for example, and all that goes around that. You've got outpatient infusion centers now. Talk more about that.
So, yeah, I would say that as Sarah and I said early on in this is America, and I think we figure things out. And whether it's initially with testing helps because you can identify it, and people act a lot different when they're tested. And then with the drugs like the bamlanivimab or the Bam and the Regeneron, we are now using that aggressively to keep people that qualify for that type of treatment out of the hospital. So what a great situation we have for these drug companies that were able to develop these things. And now the vaccines. So I think all three of those are just, I would call those huge blessings. And we should be thankful we live in America. You look at some of these third world countries, you don't even hear about the people that are struggling with this and not able to get treatments, not able to get into an ICU where they can be properly proned and managed on oxygen without a ventilator. So I think that we should count our blessings that we are Americans.
Lee Bond, CEO of Singing River Health Systems. Thank you, first of all, for being such a great friend of the show. We really appreciate your leadership in the community and there at Singing River Health Systems. And we look forward to talking to you again soon. Next time we talk, we'll talk a lot about the trends going forward. How has the healthcare profession been impacted by this? Sort of keep it in the line with the conversation that Ashley Edwards and I had. But anyway, have a great day.
All right. Thank you.
Broadcasting safe and sound from the coastal Mississippi studios, this is Coast View with Ricky Mathews on SuperTalk 103.1.